Hi, Doc.
Hi, how are you?
Me?
You can hear me?
I can hear you quite well.
All right. Any noise in my background?
Come
Or
again?
everything is, I'm saying, am I clear?
Yeah, you're clear. Yeah. At that
Okay, great.
position, you're clear.
Right.
But is someone
But is
speaking?
someone? Do you mind? Excuse me? Excuse me? Excuse me? Do you mind keeping it down? I came in here to do a meeting. Yeah, they can't hear me. Yeah, thank you.
Okay, perfect.
It's quieter now, yeah?
Yeah, it's perfect now. Your moderator is not yet logged in.
Let me find her. You know, we've just finished the WMX meeting.
Yeah. Mm,
We might still be recuperating somewhere. Let
okay.
me just,
But
it's already,
I can just let in the attendees. Yeah.
yeah, sure. Go ahead.
Okay, sure.
Oh, there she is.
Hello.
Hey, MC, we're beginning to wonder whether you're going to join us.
After a conference meeting, I get calls afterwards, so hence my delay.
Yeah. Okay.
Mercy, you have slides or you're talking? Hello?
I have slides.
Okay, I think you can upload them as we wait for guys to join.
Okay, just 1 minute.
Good evening, everyone. Welcome to our webinar today, where we will be discussing the biopsychosocial spiritual model of adolescent health in commemoration of this week's International Adolescent Health Week. Just to give a little bit of background, my name is Dr. Marie-Claire Wangari. I'm the convener of the Young Doctors Network, housed by the Kenya Medical Association. And today we are happy to have Dr. Mercy Wanjala, who is a family physician by training, currently based at our KMA Embu division and the honorary chair of KMA Embu division, who has a vast experience in matters primary healthcare, especially from an adolescent health lens. So it will be interesting to see this model that I guess most of us just interacted with in passing in psychiatry, but now to look at it from an adolescent lens, given the fact that we are currently in a world where 1.8 billion people that traverse this world are adolescents and their needs are unique. And the adolescent age group I'll be referring to in this context is people aged 16 to 24 as per the United Nations. So welcome, Dr. Mercy. Maybe you can just briefly introduce yourself and then take us through the presentation. For those of us who have any questions, feel free to ask them in the Q&A section. And if you have anything you'd like to share, for those ones who are conversed with Twitter, you can use the hashtag SEBA, hashtag PHC, hashtag KMAYDN. Thank you. Over to you, Dr. Mercy.
Thank you very much, Marie-Claire. So you already introduced me, so I'm just going to jump right into the topic. The essence of today is just to look through this model and how we can use it in adolescent health, because like you've mentioned, a majority of our population is made up of adolescents who are later on going to become adults. And they are going to form a lot of us, a huge number of our social capital. So at the end of the day, we need healthy adults who are also productive members of society. So the reason, especially why we are here today and why we are holding this webinar, is because this week is International Adolescent Health Week. And throughout the week, various people across the world are doing any activities to commemorate this week to ensure that the voice of the adolescent is heard, because most of the time they are not able to speak up for themselves. We consider them too young, so we tend to overlook them. But this week, we are raising our voices and speaking up for them, as we say, with and for adolescents, building a healthier future and more inclusive future. So just a few quotes around adolescence that I found quite interesting as we open the discussion today. There's this one that says, adolescence is a new birth, for the higher and more completely human traits are now born. That was from a poet, G. Stanley Hall. Another very interesting one that I liked was, you don't have to suffer to be a poet. Adolescence is enough suffering for anyone. The reason I put some of these quotes here is just to see what a lot of people who have been through adolescence, if you're an adult, you have been through adolescence, actually think about adolescence. I like this one by Helen, who said, adolescence is the period of the decisive last battle fought before maturity. The ego must achieve independence. The old emotional ties must be cast off. The new ones created. So you can see around the world, not only within the healthcare space, but everyone is thinking about adolescence, what to do about it, what not to do about it. And then at the end of it all, everyone wants to come out of the other side a winner. So this is just a demographic representation of Kenya's population from the last census, which was done in 2019. So we're waiting for the 2029 one, which of course must have increased. So about 24% of our population in Kenya is made up of adolescents. So that's people between the age of 10 and 19. So you can see a bulk of our population pyramid is actually made up of adolescents and youth. So you cannot have a conversation about universal health coverage, about leaving no one behind, without having a conversation of how do we strengthen and improve adolescent health within our country. So the goal at the end of it, when you're looking at the biopsychosocial spiritual approach and model to adolescent health, is to ensure that we create maintain, and restore adolescent health. Like we've seen, the age group is wide. I'll show you on the next slide. And the whole point is we ensure health, because a lot of times we talk about health and then we end up focusing on disease. If you look at most of the programs that we have around adolescent health, most of them are reacting to an issue that we've seen amongst adolescents, or they are reacting to a crisis that we have seen amongst adolescents, whether it's teenage pregnancies, or, for example, adolescents who are engaging in sex too early. We have a reactive policy around it. But now the essence of this approach, why we are calling it the missing link, it's because it is here to create, maintain, and restore health, focusing on health as defined by the WHO. That's the total psychological, mental, physical, spiritual health of a human being. And that approach is supposed to help us move our lens from a disease-based and program-based kind of view more to a holistic and person-centered view when you're looking at the adolescent and their health. So just so we are clear what we're talking about today, adolescence, as defined by the WHO, is the season of life between childhood and adulthood. That is actually a phase between the age of 10 to 19. And it's actually a very unique stage of human development and an important time for laying the foundations of good health. Why? So some of the traits which are usually acquired and predispose people to getting disease or health later on in life are either acquired in early childhood or during adolescence. And this can range from either genetics that you're born with, or some of the traits and habits that you acquire as you go either through school, as you interact with other people, how you form your social networks, how you form your view of the world. All that occurs during adolescence. And another interesting fact for those who like interesting facts, the human brain doesn't really develop beyond the age of 18. By that time, most of the neurons are set and you're not growing any new neurons. So that period between 10 to 19 years of age is very important even for neurodevelopment. And that's why this stage has to be taken seriously and with the delicateness that it deserves. So especially for us who are within the healthcare sector, we need to remember that. And as we are handling adolescents, remember that that is what this phase is characterized by. It is also characterized by puberty, which is a biological component that refers to the morphological and physiological changes that occur in a child until the maturation of sexual organs and reproductive capacity are achieved. So you see, there's a lot happening during adolescence, not only from a psychological standpoint, a neurological standpoint, but also a biological standpoint. And we will have to have healthy adults who are able to reproduce and also curb things like infertility later. Then we have to pay attention to these components when someone is actually going through puberty and detect any anomalies at that stage. So another interesting fact is back in the day, the profession of caring for adolescents was actually called hebiatry or hebiatric, from the Greek word heb, which is young maturity or bloom of youth. And it used to be a medical specialty on its own. So you can see even back in the day, adolescence was something that was taken very seriously by members of society, even members of the medical profession. So they had a specific cadre who used to take care of adolescents. But nowadays, that has been merged into what we are calling pediatrics, that takes care of everybody from childhood until the age of 18 years. So an adolescent comes from the word, Latin word, adolescere, that means to mature. So it's very important for us to remember that this is a transitional stage. It is moving someone from one stage of life to another. And that is usually characterized by stress. Any kind of change in life comes with stress. So this can come in the form of either biological stress or psychological stress, neurological stress. So there's stress on your body as your different joints are stretching, growing, you're producing new and different hormones within the body. So it's a transitional stage, and we have to remember that. And it's not only focused on the biological transition, but there's also a psychological transition and a social transition in that. That's when someone is trying to move from, oh, I used to be a child, now I'm an adult. I never used to require privacy, but now I require privacy for 1, 2, 3 reasons. So all that transition is happening at once in one person. So we have to consider that as we are approaching adolescence. So don't look at any behavior that an adolescent has as either rebellion, the way we look at it, or children nowadays are too stubborn and they're this and they're that. All that is because they're going through a transitional stage, and they need our guidance and expertise to make sure that they successfully go through that stage. So coming down to our topic today about biopsychosocial spiritual approach. Initially, it used to be the biopsychosocial approach when it was first defined by Beng in 2004, which is a model, which is a holistic approach that acknowledges the interaction between our physical, psychological, social, and spiritual aspects in patient care and patient well-being. And the reason this came about is because the traditional way of teaching medicine and practicing medicine was the biological model, which was focused on diagnosis. So when you take a patient, you try to make the patient read the textbook, like we used to be told. So you take the textbook, you try and fit the patient into the textbook and wonder, what is this patient suffering from? But what physicians have realized over the years is that this model is not working, because when you try to fix the disease, and rather than looking at the person as a whole, you find that you are having more difficulty fixing the disease because you do not know the root cause. Because studies have actually shown that for some diseases, autoimmune conditions, some chronic conditions, and things like even arthritis and various forms of inflammation in the body can actually be connected to emotions and what kind of chemical process that emotion triggers in the body. So with this kind of new discoveries over the years, we are moving away from the biological and diagnosis approach to a patient and moving more to the person-centered holistic approach that looks at the neurobiological, psychological, social, cultural, and spiritual dimensions of every patient. And just in case you're wondering, this is not only an approach that family physicians or primary care physicians should take. This is an approach that everyone should take with every adolescent that you get. Not only the ones who are sick or suffering, but also the ones who are either, for those who work either in a school environment or any kind of different environment where you're interacting with adolescents. This is a very good model for you to take in order to, one, understand the person who's in front of you, understand their problems, then finally understand how you're going to solve them. So when you come down to the biopsychosocial assessment, you have to, one, look at all the four lenses, but look at them from the point of view of the adolescent. First of all, the biological. You want to look at their current health. How healthy are they? And when you're looking at this, remember, we said they're still growing. There's a lot of biological, morphological, physiological changes that are going on through their body. There's the release of the growth hormone that is making that is giving them growth spurts. So you have to check, for example, how is their height? How is their weight? For example, even the length of maybe their arms vis-a-vis the rest of their body, because there are syndromes that present like that, and they're never even detected in early childhood because they never cause any kind of change in either intelligence or emotional behavior. So it's left until adolescence for you to start recognizing it when the adolescent is having growth spurts. So those are some of the things that you need to look at. You need to look at their oral health as well. Because remember, dentition is also something that is really forming during adolescence, as well as their jaws and the mandible is setting itself as the face is taking form as well, so that it can move into permanence, and the bones also are setting themselves into permanence. So these are some of the things that we never think to look at, but we need to look at. You also have to look at their eye health, because remember, even as they're growing, because of either sometimes the mismatch between how fast your eyes are growing and how fast the bones in the skull are setting themselves, etc., and genetic factors, you find that most of them start becoming short-sighted during adolescence. So when you have that adolescent in front of you, you have to do a full physical examination, looking at every single part of their body. So at the end of the day, you can record their health. This is where they are in terms of growth. It is where they are in terms of development. It is where they are in terms of eye health, their vision, their oral health, their sexual health, because you have to look also at their genitalia to see what stage of puberty are they. Are they delayed? Are they precocious? So all the things you have to look at in terms of when you're looking at the biological current health. Then, of course, the past health history. And the past health history has to go all the way back to when they were children, when they were born, the immunization that was done. Because, for instance, right now we are moving away from the traditional way of just saying, immunization ends at 1 year or for under 5. We are looking at immunization throughout the life course and how we can introduce that even amongst adolescents. I'll give you an example of what we're having right now in terms of a crisis, the HBV infection, for example. So you find that in other countries other than ours, HBV vaccination is part of the course, and you're supposed to get like a booster every 10 years. So at some point when you are an adolescent, you're supposed to get that as well. So when you're looking at past health history, you have to look at what are some of the preventive measures that were taken, whether they were a child or as an adolescent, any vaccinations they have received, any kind of work that whether it's any kind of medical intervention, especially any kind of dental work, etc. So you have to look at that in a holistic manner and then look at health behavior and physiological function. So in terms of health behavior, of course, you're looking at diet, exercise, sleep, if they're using any substances, and at the same time, you also have to ask how are their other physiological functions. Like we never ask the issue of how are you urinating, for instance. What is the color of your pee? How much water are you drinking? How many times do you empty your bowels? Because there are so many other diseases that usually present later in life because of such habits, and you did not ask when this person came to you as an adolescent. So we have to ask all those things, because I know we do not routinely ask because of the traditional model of looking for the disease that this person has. But this is also, you're looking at both the healthy adolescent who is in front of you, and you're also looking at the adolescent who has a potential problem, whether it's a social problem or a medical problem, you're looking at it as well. So once you have done a full bio, that is your examination, your past, you've done your past health history well, you've looked at their behaviors, you've looked at any risk factors in their behaviors that could cause any biological dysfunctions, and you've recorded that, you can move into the cycle also. And this is usually very good to do as a baseline for every adolescent that is in front of you, so that you can get to understand where they are in terms of their stage of development, in terms of their pubertal stage. You can get to understand their circumstances as well. So looking at the cycle, here is where you can do what we call a mini mental status exam, where you just want to see, are they coherent? Do they know where they are? Do they have any gaps, for example, in their intelligence? Can they do, some simple sum here and there? So there are many tools that you can use, especially for an adolescent, in terms of the mental status exam. Then you look at their personality as well. So there are so many personality tests out there. So it depends on which one you are conversant with, because by the time someone is entering adolescent, their personality has already started forming, and for some has already cemented itself. So it's important to understand their personality so that you can also understand how they're going to go through their transitional period. Because someone's personality affects a lot of things, including how they perceive sickness, how they perceive disease, how they go through stressful periods in their life. So you have to look at that, look at their mood, and let's stop the idea of thinking that all adolescents are moody. Not all adolescents are moody. It depends on their personality, it depends on what they're going through, it depends on their pubertal stage, it depends on what is happening to them biologically, because the changes in and the shifts in hormonal levels as they're going through the transitional stage can also cause manifestation of mood disturbances as well. So look at it from the individual who is in front of you. Look for any mental health conditions. You can do that through the mental status exam. You can also, there are other tools that screen for things like anxiety and depression as well that you can use. The degree of hope is important because, as I mentioned, sometimes because of the transitionary stage they're in and the multiple things that are happening to them socially, biologically, what happens to adolescents is that they usually tend to have a lot of problems that can lead to either depression or a feeling of hopelessness, which could actually be a pointer towards an underlying mental health condition. So it's good to check for that as well. And then looking for stressors, either current or previous. And the stressors can either be individual or their or their family or their environment or school. And you have to record this as well. Then from there, you move to the social. And the social is something that is very good to use, which is called a genogram. So a genogram basically is where you draw the person's family tree. From their parents, for example, if their grandparents are still alive or great grandparents, you have to start from there. see whether they're living with their great grandparents or their grandparents, whether they're living under the same roof, whether they're living with their parents, what type of family they come from. Is it a nuclear family, an extended family? Is it a blended family where, for example, you have two families, either through separation or divorce or death? One of the parents is not around, so you find there's a remarriage and a reconstitution of the family. So such things are good for you to note so that you can know what are the potential stressors for this adolescent as they're going through their transitional stage. So intimate relationships, for example, if someone has a boyfriend, has a girlfriend, or has very what we are calling the BFFs, because you can find like some friendships can be very, very intense and very close. So you have to look at those relationships, how they are as well. Look at their friends and associates, who they are, how often they hang out, and what they do when they're hanging out. If sometimes you can find some adolescents who have started working for one reason or the other, colleagues, co-workers, look for them. Any kind of community connections they have, for example, those ones who play football and basketball, etc., those kinds of team sports, and what their relationships are, those who play either in a community as well, or those who are part of other groups like support groups. You might find, especially for adolescents who are living with HIV, they have certain support groups that they go for, etc. So you also have to capture that. Socio-political environment, of course, depending on the person's context, is also important, because a lot of psychological studies have shown that when it comes to political and socio-political environment, when there's turbulence, whether it's happening to you or not, just the fact that you know it's happening or you've watched it happen can also be a very huge stressor. So that's something to look at. And also the culture. Get to understand the culture this adolescent is coming from, because their culture will influence their beliefs, will influence how they go through the transitional stage. Because in some cultures, for instance, adolescents are expected to do certain things. So it is up to us to try and understand how are you, what is your culture around adolescence, and you moving, maybe transiting from a child to an adult. Are there things you're expected to do? Here is where now the realm of things like FGM comes into play. The kind of traditional circumcision, you see, that might put the adolescent at risk. So these are the some kind of things you can capture when you're looking at the social assessment. And then finally, the spirituality, mainly spiritual practices, how they make meaning. Before, this never used to be looked at, but right now it is actually studies have actually shown that. Like one interesting one that I was reading was how when someone is either singing a worship song or praying, the same centers that light up when someone has taken a bit of cocaine are the same centers that light up when they are going through any kind of spiritual practice that they have chosen. So that is what has prompted the issue of having to look at the spirituality of everybody. So at this stage, especially for adolescents, they're still trying to find themselves, trying to find meaning. So it is up to us to try and see what are they drawing out of life in terms of meaning. What do they think spirituality is? Do they not think it's important? Do they think it's important? Is it a very big part of their life, so that we have a very holistic view of this adolescent who is in front of you? So in terms of the biological factors, just to mention a few that you're going to look at, we've mentioned genetics, family history, their physical development, intelligence is very important, because remember, they're going through school. And if you find especially the type A personality adolescents, everything is about achievement. And if they're not achieving, or if they think there's a problem with their intelligence, then that can become a very huge stressor that can be a huge disruptor. So, and also intelligence in terms of looking at the different types of intelligence, because the kind of intelligence that you'll be looking for is not only the kind of intelligence that this person is smart, is good at math, is doing well in school. There are other types of intelligence like value-based intelligence. What does this adolescent think about things like stealing, killing, lying, cheating, such like things? So that is how you can do an assessment of intelligence. And there are many tools there that show like some have like the 9 types of intelligence or the 8 types of intelligence. So you can also look at that from an adolescent and actually gauge where they are and see how you can help them either develop better or curb any kind of trait that is not that can cause developmental and social issues later on in life. Also, it's important to check their temperament. I think for those who are very much into psychology and neuropsychology, the issue of temperaments like the choleric, melancholy, what is their mixture of temperaments is also something very important that you need to look at, and any medical comorbidities they may have, because you have some of them, either they were born with a comorbidity as a child, maybe early diabetes, asthma, epilepsy. So whatever it is that they're suffering from, also make sure that you capture it, because the reason why this model is very important is science has demonstrated there's a very huge connection between our biological, psychological, spiritual, and social well-being. So they're all interconnected. So being able to tease that out from an adolescent and also being able to connect all that is how we are going to be able to actually walk into their world and have any health interventions that are going to be of meaning to them at an individual level. Psychological, we have talked about it, personality, emotional development, because I think most of us are aware of the research that has been done around emotional intelligence and how to measure emotional intelligence and the importance of emotional intelligence. Actually, the people who first discovered and started doing experiments around emotional intelligence, for example, the experiments you see nowadays on TikTok and YouTube, where parents are putting maybe candy in front of their children and then telling them, if you don't eat that candy, I'll come and add you another and another. So that came actually from an actual experiment around emotional intelligence and its importance in the development of a child or children. So that will be also something to check in an adolescent. Are they at the right emotional developmental stage? Are they having outbursts? And at what age are they having those outbursts? So such like things can also help you walk into the world of the adolescent and actually help them develop better mental health and also physical health as well. So what is insight? We also know how to check for insight. Just asking around moral questions that are common to every human being in every culture and finding out what their response would be. Their defenses, are there anything that they are defensive about? That is one. Two, how well can they cope with different circumstances in their life? That is also another realm of defense. How to respond to stressors, you can ask questions around that. And then patterns of behavior and cognition. So even as you're talking to them and having a session where you're trying to tease this out, things like when you hang out with your friends, what do you do? What do you like watching? Those ones can tell you patterns of behavior. What time do they wake up? What time do they go to bed? What are the things that they like doing? What are the things they do repeatedly? So those ones can help you tease out patterns of behavior. Around the social cultural, we also talked about it, looking at their relationship, especially starting from the family level, and then moving on to the peer relationships, intimate relationships, school relationships. Who do they hang out with in school? How are relationships with their teachers? Because you find that sometimes with adolescents, especially, and when they're going through transition, then that some of them start developing identity crisis. It becomes hard, very hard for them to socialize with other people. They have difficult relationships with their teachers. They have difficult relationships with their peers as well. So you should be able to tease that out, looking at their neighborhoods, what kind of neighborhoods they come from, because you'll find that there are some neighborhoods where children are very susceptible, or adolescents are very susceptible to things like getting into sexual relationships early substance abuse and such, because in their neighborhood, literally when they walk out of their gate, there's a bar or there's a wines and spirits. And you know, in Kenya, we have not started carding or asking how old are you before they sell. So sometimes some of these establishments just sell to anyone, and that can be a danger to the adolescents. Then look at things to do with religion and also socioeconomic status. With socioeconomic status, there are some of basic questions you can just ask them in terms of, for example, if they feel that what they have as either individuals, because sometimes you have adolescents who are given either pocket money or get money in other ways. Nowadays, people make TikTok videos and YouTube videos, especially for the ones who are digitally savvy, and they get money from it. Find out whether that is enough to cater for their needs. Are they having at least a minimum of 3 meals a day in their house? Do they have to share a room? Do they have to share a bed? Are they overcrowded? So such things can tell you about their socioeconomic status without necessarily asking them directly about money. We've talked about the spiritual, and like I've mentioned, this is still an area that is under development. because before the around 2000s, nobody was talking about spiritual approach when it came to the medical model of how do you look at the person who is in front of you. But nowadays it has been found that the spiritual is a very huge component of how we think and perceive things. And like you've noted, especially with the different generations, and now we are dealing with the Gen Zs, they have different ways of looking at things. They are more exposed. So it is important to know what have they been exposed to spiritually, what are some of the things that they believe, what are some of the things they don't believe, because you'll find that especially with adolescents, if you don't find out what they believe, every time you talk to them, they'll listen to you, yes, but at the end of the day, they know what they know. So it is important to know what they know, what they don't know, and especially what they believe. Some of them actually, right now, like a study was being done about young people in the US and health insurance. And they found out that most of them just thought to themselves, one, they're too young to become sick, so why get health insurance? Two, everybody is going to die anyway. So they're not afraid of getting disease, they're not afraid of dying. So teasing out that spiritual, what is your belief system? Do you have a purpose? What is your sense of self? Is very important in how you approach the adolescent so that you can at least understand their thought process and how what you're saying affects them and how what you're saying is actually being processed by the adolescent, so that you don't end up wondering, was I talking to myself throughout this session? It's because you never walked into their shoes and walked into what they believe in and what kind of belief system they have created around themselves. So once you've done this BPSS assessment, it's important to now come up with an approach. And that approach now is about teasing out some of the factors that you have found when you're doing your biological, social, psychological assessment and trying to see what are the problem areas and what are the areas that you might intervene. For instance, so this model, as you can see, doesn't have the spiritual part because, like I mentioned, a lot of these models before did not have the spiritual part, but that is something we are now adding. And now we want to look at if and you find a problem in an adolescent. For instance, you find an adolescent who is using substances or has started using substances. So using this 4P factor model, you can actually ask yourself, what is the predisposing factor? Why is this adolescent in front of me taking alcohol at 12 years old or smoking at 12 years old? What are the precipitating factors? What are the perpetuating and the protective factors? So just to take us one by one through those models, the predisposing factors are what actually adolescents ask a lot of times. Why me? And it's a very good model because it can help you explain. First of all, you will understand why this particular adolescent, and then you will also understand, you'll also make the adolescents understand why me. And the why me or predisposing factors are usually factors that the adolescent had underlying. So they could be biological underlying factors or social underlying factors that are predisposing them, for example, to a mental illness. If you come to the realm of alcohol abuse, for instance, it has been shown that 50% of people who end up becoming developing a substance alcohol abuse disorder actually have a genetic component that is related to it. So when you are teasing out and doing the biological factors and components, maybe one of the questions you would have asked is if they know any of their parents use substance or some of their parents use substance around the house, because it could be either an environmental thing or it could be an underlying condition whereby this adolescent was influenced by the friends looking at social factors to take a bit of alcohol. But because they're genetically predisposed, they became addicted and couldn't stop. So now that predisposing factor is helping you answer the questions, why me? Because like I mentioned, we can't all blanket and say all adolescents are stubborn, all adolescents are rebellious, all adolescents do this, all adolescents do that. No. So this predisposing factor will help you understand why some adolescents actually end up either in substance use addiction, have peer pressure issues, but some adolescents actually don't, and they have a different set of problems. So it's important to tease out the predisposing factors. Then after you've looked at the predisposing factor, you look at precipitating factors. So this adolescent that we've taken who is having an alcohol abuse problem at 12, what are the factors that are precipitating this? Why now? Because you're asking yourself, why now? Why at 12? Why not at 18? Why not at 15? You know, why not at 19 even, when at least they're an adult? So they are typically some of the stressors which we talked about when we were teasing out the issue, especially of the social factors and other factors. They could be either positive or negative predisposing factors. For example, a parent has left the household. A parent, for example, parents have separated or parents are fighting. These are some of the precipitating factors. What triggered this particular adolescent to start taking alcohol? So you might actually relate that to them trying to numb the pain. So that will be your precipitating factor. Some of them, for example, might go to school, and because they're having either precocious puberty, someone is making fun of them, or some of them have delayed developmental stages, so people are making fun of them, so they're having an identity crisis. And that identity crisis is leading them to try to numb the pain. So that is how you can also tease out some of the precipitating factors. Then now we move on to the perpetuating factors. Perpetuating factors are answering the question, why does this continue? Yes, this person started drinking at 12. Yeah. So they're 16, they're still drinking. They're 17, they're still drinking. They're 18, they're still drinking. And you're asking yourself, okay, so the precipitating factor that happened when this child was 12 is no longer there. For instance, either the parents are no longer fighting, or the parent who left the home has come back. So why is this teenager still abusing alcohol? So there could be many conditions which are perpetuating that. It could be a family condition, or community, or friends, you know, the social component, friends who are still encouraging them to do it, or it gives them a kind of sense of power or control over their situation, so they keep doing it. So example of this can be an unaddressed relationship conflicts, like I've mentioned, especially within the family, lack of education, for example, for teenagers who end up dropping out of school, financial stresses, especially from the family. You find like teenagers who, for example, a parent loses a job. So they used to live in a nice posh neighborhood. Now they have been moved to, for example, a neighborhood which they consider maybe smaller, worse, etc. So you find that can actually continue precipitating the substance abuse in this teenager. The other thing that you need to be able to tease out when you find a problem is protective factors. So protective factors, especially if you've teased out the personality of this teenager, it's their temperament. You find that like there are certain temperaments because of either their agility, their ability to lead, their ability to control situations. You find that something that happens to one adolescent will crush them, while this other one will actually thrive. And that is because they have these protective factors, which could be competency, skill, talent, either an interest. Like some teenagers find that things like art and music are very cathartic. So if you ask them why they write poems, why they play music, why they paint, it's because that is how they let out any emotions that they may feel, any pent up rage, any kind of, whenever they have any kind of stress, that is how they actually deal with it. So you find that that skill that they have is actually a protective factor. Going down maybe to teenagers who are coming from maybe a background like they live in the slums, and you find that they have a skill like playing football, they are very good at it. And you actually find that this play football, one, keeps them fit. So it takes care of the biological component. Two, keeps them sharp. And then three, it also keeps them away from substance abuse that they could have fallen into. So it's very important to tease out some of these protective factors so that you can understand how do you better help this adolescent to strengthen those protective factors while you're dealing with any other factor that the protective factors while you're dealing with the negative, either perpetuating or precipitating factors that you may have realized in your assessment. So this is now how, for example, if you are filling in a 4P factor model with a BP assessment for an adolescent, it would look like. So for example, predisposing factor for this adolescent that we found at 12 years is now abusing alcohol. So in the biological, you can find maybe genetic vulnerability, toxic exposure in utero, for example. In the psychological, You might find maybe the issue of isolation, insecurity, then the social, maybe domestic violence, poverty. So this is how you would fill this table once you've done your BPSS assessment and you've looked at the 4P factor model. So you can imagine what kind of a good picture this gives you of the adolescent who is in front of you. You know what biological problems they have, what psychological problems they have, what social problems they have, what spiritual problems they have. And then from this now you can tease out what you need to intervene. So here is where now we are coming to the intervention. Why are we doing all this? Because it looks like a lot of work and you're like, why should I have to go there? It is because we need to intervene for these adolescents and not interfere. Most of the times what we are doing is more of interference. You come and find, for example, a teenager who has had her first pregnancy, this is her second pregnancy, she's in front of you. The one thing that you will tell her is, stop getting pregnant. Then, if you're kind enough, you might give her contraceptive. If not, you'll actually chase her away from that place and tell her not to come back. That is more of interference and not intervention. So the whole thing about going through this BPSS assessment and the 4P factor approach is to be able to intervene. Because with an intervention, you actually have pinpointed a specific problem or pinpointed a specific area where you want to intervene, and you know the impact that is going to have in this teenager's life, other than the blanketed approach that we usually have. So your interventions are actually actions which are supposed to be tailored towards the problems identified by the BPSS assessment, and prevention is the name of the game. And I'm going to tell you why we are going to focus on prevention. And this, like we mentioned as we are starting, the objective of this whole assessment ETC for these adolescents is to create, maintain, and restore any stock of health that may have been lost. So how do we do this? At the end of the day, once you've done your BPSS assessment and you've done your 4P factor approach, you have to develop what is called a problem-oriented medical record system of keeping the record. So your BPSS assessment for this adolescent goes into a database, and the 4P factor also goes into a database, which we might call the adolescent file, for instance, but it is their record. And then develop a problem list. From your assessment, what are the problems that does this teenager have? So you might say, this teenager, first of all, for example, if you found this teenager is asthmatic, this teenager is smoking, this teenager is fighting with their parents, for instance, or is having problems in school, cannot concentrate in school, etc. So you actually list your problems that you found in this adolescent, and then you come up with a plan of action. And that plan of action, like I've mentioned, has to be specifically tailored to the adolescent in front of you. We don't have a blanketed approach. You don't go to a policy and say, now the policy says A, B, C, D, because some of these things are not in the policy. So what are you going to do about it? Approach it from the person-centered point of view. And this is the adolescent who is in front of you. So you come up with a plan of action. Once you come up with a plan of action, you will be recording notes on progress. So this teenager came 12 years, is using substances. These are the list of problems they have. This is my plan of action. And this is the progress that we've made to this day. He used to take 5 bottles of, for example, either cheap liquor, beer, spirits, whatever, a day. Now he is down to 1. He's no longer fighting with his parents. So that's kind of an approach. So this POMR, which is the problem-oriented medical record, is just a quick medical approach that provides a quick and structured acquisition of the patient's history. So when someone opens, the first thing they see, they'll see the BPSS, then they'll see your 4P factor approach, and then a list of problems and a plan of actions and a progress report. A very simple way of just taking a snapshot of the problem. So in terms of prevention, the reason why I mentioned prevention is the name of the game is there are different stages of prevention, all the way from primordial to quaternary. So depending on the adolescent that you found in front of you, and remember it's a wide age range, all the way from 10 to 19. So you have to consider, one, the age of this adolescent. Are they 10? Are they 11? Are they 12? Are they 13? At what stage of development are they? What are their social, biological, etc. factors that you have found? And then what kind of intervention do you need to make? So depending on what level that you find them, for example, for primordial prevention, that one we're not going to go too much into it because this one is for all adolescents. Like now what we have, the national, what is currently in development, the National Adolescent Health Policy. That is a primordial prevention because it tells us how we are supposed to approach any adolescent, what programs are supposed to have with them. For example, what I've mentioned earlier, it should include, for example, how do you prevent adolescents from getting diseases? How are you going to ensure that their biological, psychological, social needs are being met during their period of transition? Because we don't want to just focus on sexual and reproductive health. Because a lot of the policies that we have, one, are focused on sexual and reproductive health. Two, they're also focused on specific problems, reactive problems like mental health for adolescents, this and this for adolescents, anti-bullying for adolescents. But now with this approach, we are looking at everything and how it is interconnected. So primordial prevention would be more of government policy, how you create an environment they can thrive in. So for example, right now, especially in our schools, there's certain standards they have to meet. For example, they have to have a playground or a field for exercise because we said adolescents are growing very fast. There's a lot of morphological and physiological changes taking place. So they need exercise, they need fresh air, they need fresh food and nutritious food. So all that, creating that environment is part of primordial prevention, and it is an approach for all adolescents. Then for the healthy adolescent, you have done your assessment and you found that they don't really have any problems in the terms of their biological, social, etc. So they're generally healthy. So for them, you do primary prevention. So primary prevention, they do not have a problem now, but might have a problem in future. For example, if you find an adolescent who has a history of obesity in the family or a history of diabetes and hypertension, what are you going to do? You're going to do primary prevention, which is ensuring, for example, they change their eating habits, diet, exercise, sleeping, so tailored specifically for them. And the other thing that you have to do, especially when you're doing primary prevention, it's important to link with the other social linkages within this adolescent life. One, the parents, which is the family, or any extended family or guardian that they may be staying with. Two, the school, because like we've seen in the primordial prevention, the environment within which these adolescents are either thriving, surviving, etc., is very important. So that linkage also has to be met, so that you ensure that whatever interventions you're coming up for this young girl, this young boy, are also done throughout the systems with which they interact with. For example, if they have friends who are always eating ice cream and pizza, of course, either they leave those friends and make new friends, or they find a way of those friends supporting them. So looking at such support systems, etc., is very important. Then there's something also called mental resilience training. This is whereby you guide the adolescent through how to react to situations or how to deal with situations. Because we've already agreed that it is a transitional stage, there's change, there's obviously going to be stress. So how do you react to that stress? How do you deal with it? So that is part of primary prevention, because you don't want them to go into anxiety, depression, or get any other kind of mental illness as well. For secondary prevention, this is now for the adolescents who are already either at risk maybe the one who started smoking, who started drinking, but is not yet, for example, addicted, etc. These are people now you can go into. One, make sure you screen them for the diseases like diabetes, hypertension. Those ones who are already active, they need to be screened for things like HPV and cervical cancer as well, because like you've noticed, things like cervical cancer are now getting people at a younger and younger demographic. So here is where your screenings really come alive. So you have biological screening methods, you have the screening methods for mental illnesses like anxiety, depression, etc., especially for those who are predisposed either through family history or either through the stresses that you have found or through either past trauma, childhood trauma, etc. So you can always screen them and arrange for screening for them at least either every 6 months if you can, or at least once a year. Make sure you have done the screening. Then now for tertiary, now it's for the sick adolescent. They're already sick, so you're trying to prevent them from getting permanent disability or damage from the disease that they have. So for this one, for example, they already have chronic disease. It could be HIV, it could be cardiovascular disease, it could be renal disease. So whatever chronic disease they've already developed, your work here is to ensure that they don't develop permanent damage, or they don't develop what we are calling they don't develop any kind of they don't develop any kind of now, for example, either secondary disease from what they have, or have permanent damage to their organs, so that they just live a healthy life despite the fact that they already have a chronic condition. So tertiary prevention is mainly rehabilitation efforts. Then there's a realm called quaternary prevention. So because we all acknowledge that we can have adolescents who are either suffering from cancer or other terminal illnesses as well. So in this realm, your intervention, your work would be to ensure, one, they don't get any treatments that do not add value to their quality of life. So someone already has a permanent disability, for instance, or someone already is in the terminal stage of an illness, they require palliative care. So yours is to just make sure they do not undergo any other procedures, or they don't get any medication that will not be of any benefit to them or to their health. So in summary, we've looked at the BPSS model, how to do a BPSS assessment for an adolescent, how to frame it within the 4Ps factor framework, how to tailor intervention to prevent. Because remember, we've said prevention is the name of the game. Because remember, these people are still young. They still have their whole life ahead of them. So it is up to us to ensure that they live a good quality life and they live a long life. Because remember, we've talked about the issue of social capital. Nobody wants to lose a child in their in a young life. For example, reducing morbidity and mortality will be very important. One, for social capital, two, for the family, because like we keep saying, nobody wants to bury a child. And the adolescent period is usually a very stormy transitional period, and it is up to us to make sure that we keep them alive and healthy long enough for them to transition into adulthood. And remember the problem-oriented medical record, which will give you a very good snapshot of what is this adolescent suffering from, what is this adolescent need, and amongst other things. And with that, I think we can have time for questions, because I saw people raising questions during the presentation. Over to you, Marika.
Yeah, thank you, Mercy, for that detailed presentation. I think I'd like to ask us to just extend by about 10 minutes. I know we're supposed to have finished at 8 o'clock, but the presentation was pretty in-depth. And I saw a raised hand in the middle of this presentation. I don't know, you can raise your hand if you'd like to ask verbally, but I'll handle the questions on the chat. And the first question, I think, of course, is the standard, will we get this presentation after this? So Mercy, you can answer that person one-on-one. But besides that, I think for me, my main question I'll have for you is, given all you've presented, if you were to summarize to just 3 short sentences of what we should focus on for each of the components of the model, what will you advise doctors who are tuned in today to look out for, or why this model is important, especially for those ones who've joined in the middle of the call?
I think the most important thing, like I mentioned, is we're dealing with adolescents, a major part of the population, and most of the time, most of them are healthy. Our work is to create, maintain, and restore their health. So focus on a holistic approach. That's what I would say. Let it be holistic, looking at this person from all dimensions of their life. Yeah, that's what I would say in summary.
All right, so look at adolescents in all their dimensions. I think I'm not seeing any additional questions, but I think also one thing that stood clearly for me is for us to get rid of this notion that adolescents are moody people and just walking around with moods. They are unique people with unique health needs, so we should especially try and use this model because it will make us have a more holistic way of managing cases that involving adolescents. I see our KMA president has commented on the presentation. It said it will be uploaded to our web. This recording will be uploaded to the KMA YouTube page. Thank you so much. Besides that, because I don't seem to see any additional, yes, Ogot John is asking, any comment on review of systems for adolescents using heads? That is home life, education, activities, stroke employment, drugs, suicidality, and sex.
Thank you for that, John. I think that's one of the tools that people use because everyone has to develop a system to remember and do things. It's a good one, but like you see, it's a bit limited. And you've seen the BPSS has like other dimensions that might not be covered in that acronym and system. So even as you use that system, let it just be a guide such that you don't just focus on those specific things, but you focus let it be just a trigger to remember like the things that you're supposed to focus on. For instance, if you're looking at the home life, and the home life, you know the things you're looking at from home life. You're looking at the family, you know, where they live, how they stay, socioeconomic status, and such things. So it's a good guide for you to trigger you and help you remember, but don't just leave it at head. Ensure that at the age you add everything that has to do with home life, education, everything that has to do with that, what we talked about, the issue of intelligence, if they have visual problems, how they're relating at school, etc. So just make sure it's a guide, but not the whole list.
All right, thank you, Mercy. I saw a hand raised, and it still seems to be raised from Abu Bakar Omar. So I'll just allow you to talk. Maybe you could share your question, and then after that, we can do closing remarks from a representative of our national executive. So over to you, Abu Bakar.
I think they might have left the session. Maybe they just forgot.
Yes. All right, we have someone from Uganda who's on the call who's saying, does this model work for adolescents who have mental health disorders? Dr. Mugume from Makerere University.
This model works for everyone. That's why you've seen, like we had, when we're talking about interventions, we had one for all adolescents. We had one for sick adolescents. So it doesn't matter where the problem is. This model can be applied to any problem because like I mentioned, science have realized there's an intersectionality and interconnectedness between our biology, our psychology, our social life, and our spiritual life. So even this adolescent who has a mental health condition or disease, you'll come to realize there could be precipitating factors that are social. There could be some factors which are biological because like I've mentioned, sometimes the changes that they go through, that surge of hormones, mixture of chemicals, etc., can also manifest itself in a mental health disorder because that also causes a bit of effect in the neuropsychology as well. So whatever problem any adolescent has, you can apply this model because it will help you be able to narrow down the problem and see how you can mitigate or even help them cope better. So it works for any problem an adolescent can have, and not even just adolescent, especially for us who are in general practice. You can also apply the model to other people other than the adolescent family, for instance, because if they have social ties and the problem is coming from the family as well, you might have to extend your intervention to the family as well.
All right, fantastic. I think I'd like to hand over to the KMA president if he's able to just give us a few closing remarks, and then we can end this webinar for today. The conversation continues this International Adolescent Health Week. We will be having a Twitter space on Saturday, but now we'll be looking at the intersectionality of climate change, or rather climate justice and sexual reproductive health and rights from the lens of young people. Young healthcare practitioners and people working in the climate change and sexual reproductive health and rights space. So the reminder is already, the Twitter space link is already live on the KMA Twitter handle. So please do set that reminder. So over to our KMA president, Dr. Kigondu.
Yeah, thank you very much, Dr. Mary Claire, and thank you very much, Mercy, for a very insightful talk. I think this talk will go a long way in improving the way adolescents are viewed and treated. And it also works, I suppose, also for adult medicine. I think this has been brought out very well. And as we said, the presentation will be available on the KMA YouTube page. It's good for those who may have missed something or they may want others to share in the knowledge, to keep sharing as it were. As Mary Claire has said, this series of webinars will continue, and we want to thank the Young Doctors Network for this very able presentation. I think adolescent medicine is a bit needs more and more similar sessions, because it's a very interesting time, so to speak. With that, I want to say that the Kenya Medical Association will continue bringing these presentations to you, and we also want to welcome all of you to the Kenya Medical Association Annual Scientific Conference on May 10th to May 12th in Mombasa at Pride in Shanzu. And I think we look forward to the Twitter space that Mary Claire and team have organized for us. Thank you very much, Mary Claire.
All right, fantastic. So from us at Kenya Medical Association, thank you all for attending. We will be giving communication for those who have qualified for the CPD points, and do enjoy your evening ahead.